child is suffering from tonsillitis, ear infections, or problems with their adenoids, choosing a surgical option is not an easy decision.
No, it's not. And as parents, you really want to make sure your kids are seeing the right doctors, and trust is a huge part of that.
It is. From ENT Consultants, welcome back, Dr. Jessica Moran-Hansen. Good to see you.
Good to see you guys again. Thanks for having me back.
Yeah.
Absolutely. So, what pediatric surgeries does ENT offer?
So I think some of the most common things that we offer for children are going to be ear tubes and then tonsillectomy and adenoidectomies. Those two surgeries make up probably the most common surgeries performed in the United States, actually.
Yeah, ear infections. I know that's a big one. We dealt with that with Grayson all through, and he had to have tubes and the whole ball of wax. But what are some of the treatment options for ear infections?
So ear infections, you know, the first line of treatment is just going to be medical therapy, which is usually just a form of oral antibiotics. If a kid fails that, then sometimes they actually have to go into getting like injection antibiotics. And then if they fail that and they've had problems with persistent ear infections and the fluid has persisted behind their eardrums and it's not going away, then we would consider putting ear tubes in their ears at that time.
So what are some of the signs of an ear infection? How can you tell as a parent?
As a parent, I think it's so difficult. Trust me, I have two kids too. You know, a kid can't tell you when their ears hurt, and so sometimes they're just fussy, they're not sleeping well at night, they're not eating like normal. For an adult, we can say, yeah, my ear is killing me, I'm not hearing very well. But for a child, it's one of those things where you really have to take them into your doctor so that we can actually look in the ears and say, yes or no, this is what's causing the problem, because it's just hard to know in a child. They can't tell you what's going on.
Right.
Why are some kids so susceptible to ear infections? Is it because their ear canals haven't developed and it's a small? How does that work? What's the deal with that?
So it's actually your eustachian tube. So your eustachian tube is the tube behind the eardrum that equalizes the pressure behind the eardrum where the fluid actually builds up. In children, the eustachian tube is not at a 45-degree angle like it is in adults. It's actually kind of more horizontal, so we don't have that gravity helping us to actually drain the fluid there and equalize the pressure. Plus, their immune systems just aren't as developed as an adult is. So as they get bigger, that tube gets more of an angle where it can actually drain with gravity and actually gets the muscles a little bit stronger. Then children actually usually just grow out of their ear infections.
So if someone, or kids, excuse me, get ear tubes, talk about swimming. Do you have to take them out, or how do these things come out of your ear?
Have you seen that? I mean, they're so
I don't know. I don't know
tiny.
much about them.
Like the tip of a pen, I would say. You know?
They're so
Okay,
small.
so here we go.
Yeah, and so this is just kind of a little illustration about where we put the ear tube in the eardrum. You just make a little incision. You actually slide that ear tube right into the eardrum after you've kind of suctioned out all of that fluid that's usually stuck behind the eardrum. In the old days, we used to say, yeah, as soon as you get ear tubes, you can't go swimming anymore.
Right.
Every time you take a bath, you got to put earplugs in. There have been new guidelines developed by the National Academy of Otolaryngology, and they say that that is not indicated anymore. We don't recommend that you put earplugs in every time they take a bath or go to a clean swimming pool. You know, sometimes if you're going to go to what we call, you know, freshwater, like lakes and rivers and stuff like that, then we consider earplugs. But nowadays, you do not have to avoid the pool, bath time, or even water sports for kids.
We have a lot to talk about today, so let's move on to our next topic, adenoids. Tell us about adenoids.
So your adenoids.
I had my adenoids out when I was young.
Yep.
I did not have tubes put in, but the adenoids, what are they?
Yeah, I think the biggest question is, where are those adenoids?
Right.
And so this is a great illustration. You can't actually see them, but you know that little ball that hangs down the back of your throat, your uvula, if you went up and behind it, they're at the very, very, very back of the nose.
Okay.
And so for children, they're actually a common cause of nasal obstruction because they're actually right there at the back of the nose. And so for kids, when they have problems with their adenoids, oftentimes they're having like a lot of nasal congestion, a lot of that, you know, thick green snot that just doesn't go away. They may have a really nasally voice. Your dentist may actually comment that, you know, their palate or the roof of their mouth looks a little bit different, and that's something to see an ENT doctor about.
Okay, so why do some children get both ear tubes and adenoid surgery then?
Right, so if you have nasal symptoms and also ear symptoms, it is common that you would get both because we talked about that eustachian tube. The eustachian tube actually drains into the back of your nose right around your adenoids. So if the adenoids are really big, they can actually cause some blockage, or they could just kind of be a bed of infection that is always going up those ear tubes. So studies have shown that if you're having problems with both and you needed like a second set of ear tubes, taking out the adenoids at the same time will reduce the risk of having to have a third set of ear tubes. So it's all based on the symptoms. You know, if the nose is perfectly fine, we usually leave the adenoids alone, but I mean, how many times do kids usually have that constant runny nose all the time when they're having their ear infections? It seems like they correlate very frequently.
We got the ears, we got the adenoids. adenoids,
Yep.
and now on to tonsils.
Right.
From the beginning of time, it seems like tonsils have been a big problem for kids.
That is true, but we have changed kind of our criteria about taking them out. It used to be, you know, if you have tonsils
Right,
and
take 'em
they're
out.
still in there, you're taking them out. We've gotten much more specific about reasons that we should take them out nowadays.
Let me just say, I got my tonsils out when I was 19 or 20, and it
Oh,
was
did you really?
miserable in college. So if your kid is suffering from any of this and you think they should get them out, maybe go to the doctor, go to ENT.
And here are the guidelines right here. What
Right.
is this explaining?
So we've kind of come up with these numbers now where we know that the benefits of surgery are going to outweigh the risk of surgery. So if your child has had 7 or more infections of tonsillitis within the last year, or 5 or more infections a year for the last 2 years, or 3 or more infections every year for the last 3 years, those are kind of the number criteria we use about, okay, this is enough infections that it's really affecting the child's life. If we actually take your tonsils out, we're going to give you more benefit than we would harm at that point.
When you talk about infections, is that strep throat?
Right, so oftentimes people come in and they say they've had lots of tonsil problems, but it's not strep throat, so they're a little confused. Strep throat is just one form of tonsillitis. You can get tonsillitis from a virus, which is not any form of strep. So it does not have to be strep throat for it to be tonsillitis. Usually the signs and symptoms are you have a very painful sore throat, you look back there and the tonsils are big, red, swollen. Sometimes they get those little white patches all over them. People often feel like they're swollen in their neck glands. You can even have some fevers. So those are all signs of tonsillitis, but it doesn't necessarily mean that you have strep tonsillitis.
Yeah. And then snoring, is that one of the other symptoms of tonsillitis?
So
issues
it's one
with
of the
tonsils?
signs of having big tonsils. So oftentimes people come in with their kids and they just say, well, my kid has big tonsils. Big tonsils can cause a problem if they're actually affecting sleep at night. So obstructive sleep apnea is very common nowadays in kids, actually. So one of the most common reasons we're taking tonsils and adenoids out in kids is not that they're commonly having over and over infections, but actually it's causing problems at night where they're actually obstructing and stop breathing at night. And we can actually usually cure that by taking their tonsils and adenoids out.
All right.
I feel like we hit a lot of subjects today.
We
I
hit
kind of feel like we
lot
did
of
too. But very
subjects.
common questions. So it's
Yeah,
good that we
they're common
touched a little bit on all of them.
There's so many other questions out there you may have. OmahaSinus.com is a website you can go to, and
Yeah.
you're there to answer any questions.
Always give us a call.
Thanks,
Thank
Doctor.
you.
Good to see
Good
you.
to see you guys again. Yep.
Winter is